Hi, my name is Julie Guldager, and I'm an assistant professor at the University of Southern Denmark and University College South Denmark. At University College South, I work with the SHE secretariat, or Schools for Health in Europe secretariat. With this presentation, I would like to first present you two different perspectives of health and how your perspective can influence the way you work with health promotion. Thereafter, I will give you two examples of how your perspective of health can influence the way you work with health promotion. One is from my own research and one is from Schools for Health in Europe, which is also referred to as SHE. So first, the different perspectives of health. There are very different ways of thinking about health. One is the more traditional model of infectious diseases, which is called the epidemiological triad. Here, health is seen as an interaction between the susceptible host, the external agent, and the surrounding environment. Another model is the epidemiological model where risk factors are introduced. So those are the factors which increase the risk of developing a disease. A very different model is the model by Dahlgren and Whitehead called the social model of health. This model consists of 5 layers in a circle. In the middle, there are the factors like age, sex, and so on, which cannot really be changed. The next layer is the individual lifestyle factors, where you can actually intervene in health promotion. The next layer is the social and community networks, which is surrounded by things like, for example, the work environment, education, unemployment, and so on. And the outer layer are the general socio-economic, cultural, and environmental conditions. So all these different things can influence health to a smaller or larger degree, depending on what aspect of health you are working with. Had I been there with you now, I would have initiated a discussion with you to see what your perspective of health is and how that can influence your work. Perhaps you can do that without me. Now I will show you an example of how your perspective of health can influence the way you work with health promotion, in this case with my research. I would like to give you a little bit of insight in some of my results of this study. And my study was based on a Danish school-based health promotion program called Active All Year Round. This is a 3-week-long free program which has been offered annually to all elementary schools in Denmark for many years. It has its main focus on physical activity, but also includes some aspects of healthy eating and sleep. It's the teachers at the school who implement this program, and the program is very flexible. So there are some core components, but besides that, the teachers can choose how much they want to use this program during the 3 weeks and how they want to work with the program material. For our study, we wanted to investigate first to which degree the program was implemented at the school, so how much they actually used it. And secondly, we wanted to find out if student background and school context affected the implementation. From this work, we have published a paper which you can find online in case you want to dig in the details. But for now, I will just give you the very short version. So remember, our objective was to find out if student level and school level context factors affect level of program implementation. Our outcome variable, or what we measured, was a composite score of implementation level. So how did we do this? Well, from a list of all the schools in Denmark which had signed up a 5th grade school class for the program, we recruited 16 schools. Data came from a student survey, a teacher survey, in-class observation, and register data. So what did we find? Well, from the composite score of implementation, schools could get between 4 and 16 points. The mean implementation score was 12. On this graph, I have grouped the implementation score of the schools into quartiles. And as you can see here, 60% of the schools had an implementation score in the third quartile. And interestingly enough, there were no schools who were placed in the highest quartile of implementation. So what about the next research question, where we wanted to find out if school and student context factors had affected the level of implementation? Well, for this we did a mixed model analysis, and here I will show you if any of these following 4 parameters actually affected implementation. So I looked at school connectedness of the children, the size of the school, the school's parental level of socioeconomic status, and school's prioritization of health promotion. Here are the results. In an analysis like this, only the results where the confidence interval, here shown as this vertical line, do not cross over the value of 0. So, as you can see here, the program was implemented to a higher degree for students who had a stronger sense of being connected with their school. And that was measured regarding their connection to their peers, their connection to their teachers, and their connection to the schools. The other 3 parameters were not statistically significant, so there was no connection there. So school-based health promotion programs can actually be improved by knowing before the program is implemented which factors increase the odds of better implementation. This presentation of my research results is an example of how we in Denmark use this wide definition of health. This wide definition can also include aspects like, for example, empowerment, and including the context, as I did here in my research. So now I will move on to the last part of my presentation and present how the perspective of health can influence the way she works with health promotion at school. At SHE, we use also the wide definition of health. In the field of school health, SHE has what is called a whole school approach and works with specific values and pillars in all their work. This tree illustrates how, when you work with this whole school approach, your approach consists of more aspects than, for example, just healthy eating or physical activity. Your approach includes both the school physical environment, the social environment, community links, healthy school policies, individual health skills and action competencies, and health services. So she actively uses this approach and aims at creating a common international perspective of health. So that is all for now. And remember, we would also be happy if you and your friends would follow SHE on our social media channels. And you can find those at the bottom of our webpage, as you can see here on the screen dump. You can also subscribe to our free newsletter if you go to Newsroom at the webpage. Thank you. Bye.